Picoxib is an emerging solution for the management of inflammation and pain. A unique non-steroidal anti-inflammatory drug with a better safety profile and dual mode of action, Polvolt 2 mg blocks both carbonic anhydrase and cyclooxygenase 2 enzymes. Currently available, first-generation NSAIDs like naproxen, diclofenac, ibuprofen etc. are non-selective and inhibit both cyclooxygenase 1 and cyclooxygenase 2 enzymes, leading to gastrointestinal and cardiovascular side effects. Therefore, to overcome these adverse effects due to cyclooxygenase 1 dependent mechanisms, several new selective cyclooxygenase 2 inhibitors have been developed. Selective cyclooxygenase 2 inhibitors such as celecoxib, rofecoxib, valdecoxib etc. reduce the gastrointestinal tract side effects but increase the cardiovascular side effects. Due to these serious cardiovascular events, including cardiac arrhythmias, hypertension, myocardial infarction, leading to the withdrawal of these drugs from the market. Therefore, there remains an unmet medical need for new alternative coxibs that do not cause cardiovascular adverse effects. Introducing Polvolt Pharmacokinetics, a next-generation NSAID with tissue-selective cyclooxygenase 2 inhibitor. A first-in-class NSAID, which is a dual inhibitor of cyclooxygenase 2 and carbonic anhydrase enzymes. Tissue-specific, once-a-day orally active drug with half-life of 5 days. Pharmacokinetics provides a novel tissue-specific transport mechanism that is designed to deliver sustained levels of the drug to the inflamed tissues while maintaining low systemic exposure. The core structure of both cyclooxygenase 2 and carbonic anhydrase enzymes are similar due to their aryl sulfonamide moiety. Selective cyclooxygenase 2 inhibitors containing a sulfonamide moiety also act as potent inhibitors of several carbonic anhydrase enzyme isoforms. Since Pharmacokinetics contains sulfonamide, thus it inhibits both the enzymes. Carbonic anhydrase concentration is very low in the inflamed joints and tissues, whereas cyclooxygenase 2 concentration rises in the inflamed tissues. The greater the distribution of carbonic anhydrase in the tissue, the lesser the inhibitory action of cyclooxygenase 2. Wherever cyclooxygenase 2 and carbonic anhydrase coexist, high affinity and preferential binding of Pharmacokinetics to carbonic anhydrase takes place, thus reducing the cyclooxygenase 2 inhibitory activity of Pharmacokinetics. Cardiovascular side effects are reduced since cyclooxygenase 2 enzyme is spared in cardiac tissue. Pharmacokinetics with its dual mechanism of action minimizes the adverse cardiovascular side effects related to cyclooxygenase 2 inhibition due to competition between two enzymes for binding to active site of Pharmacokinetics. Carbonic anhydrases acts like a sponge for Pharmacokinetics due to high preference of Pharmacokinetics towards carbonic anhydrase in the cardiovascular, lungs, gastrointestinal tract and kidneys. Pharmacokinetics has a tissue-specific action. It provides a novel tissue-specific transport mechanism that is designed to deliver sustained levels of drug to the inflamed tissues while maintaining low systemic exposure. Interestingly, 3 Pharmacokinetics molecules bind to one active site of carbonic anhydrase 1 enzyme, whereas 1 Pharmacokinetics binds with the carbonic anhydrase 2 enzyme. Carbonic anhydrase directly competes with cyclooxygenase 2, hindering the inhibitory activity of Pharmacokinetics against cyclooxygenase 2 in the gastrointestinal tract, lungs, liver, heart and kidneys. These are the primary organs where selective cyclooxygenase 2 inhibitors exhibit side effects. Carbonic anhydrase 1 and carbonic anhydrase 2 inhibition by Pharmacokinetics reduces the potential side effects mediated by cyclooxygenase 2 inhibition because carbonic anhydrases have a preference for Pharmacokinetics, sparing side effects in organs like gastrointestinal tract, kidneys, lungs, and heart. This unique dual cyclooxygenase 2 and carbonic anhydrase inhibition are designed to provide potentially superior safety to cardiovascular, renal, respiratory, and gastrointestinal tissues compared to traditional NSAIDs or cyclooxygenase 2 inhibitor drugs. Importantly, low-dose administration of Pharmacokinetics, only 2 mg, has shown to have a negligible inhibitory effect on the required carbonic anhydrase enzyme function in the circulatory, gastrointestinal and renal system, despite Pharmacokinetics theoretically remaining in a combined state with carbonic anhydrase enzyme. There are many advantages of Pharmacokinetics over other cyclooxygenase 2 inhibitors like celecoxib. Pharmacokinetics is a first, tissue-specific and selective, once-a-day osteoarthritis drug with half-life of 5 days. It has unique mode of action. It is a dual inhibitor of cyclooxygenase 2 and carbonic anhydrase 1 and 2 enzymes. Due to this unique mechanism, Pharmacokinetics specifically targets affected or inflamed joints only, and healthy tissue is spared of the side effects. quick onset of relief from the signs and symptoms of osteoarthritis in comparison to celecoxib. It has highest potency among the available NSAIDs. Only at a 2 mg per day dose, the lowest dose amongst all known NSAIDs. Convenient once-a-day regimen provides better compliance in patients, unlike most other NSAIDs, due to long half-life of Pulmocoxib, which is approximately 5 days. Significantly improved gastrointestinal, cardiovascular, pulmonary and renal safety as compared to the traditional NSAIDs. The tissue-selective mechanism provides enhanced cardiovascular safety over other NSAIDs. Long-term safety established in long-duration studies extending up to 6 months of continuous usage. As compared to the traditional NSAIDs like naproxen, diclofenac, ibuprofen or selective other cyclooxygenase 2 inhibitors like celecoxib, Pulmocoxib shows highest cyclooxygenase 2 selectivity due to tissue-selective carbonic anhydrase inhibition. It spares cyclooxygenase 2 enzyme. Pulmocoxib with once-a-day administration shows enhanced gastrointestinal and cardiovascular safety. In pharmacokinetic studies, drug exposure in whole blood is 80 to 100 times higher than in plasma. The maximum plasma concentration reaches 5.5 to 72 hours after administration, and the steady state is achieved about 20 days after the start of administration. The half-life of a single dose of Pulmocoxib is approximately 5 days. This drug is mainly metabolized by CYP3A4, however concurrent administration of ketoconazole, a strong CYP3A4 inhibitor with Pulmocoxib, doesn't change its safety profile. Pulmocoxib is excreted both via feces and urine. Indications and dosage administration. Drugs Controller General of India approved Pulmocoxib 2 mg capsule in India on the 1st of May 2023 for the treatment of osteoarthritis of hip and knee joints. Recommended adults dose is 2 mg once daily. Maximum dose should not exceed 2 mg per day, since the drug is slowly accumulated in plasma and reaches steady-state concentration in a few days. Pulmocoxib is not recommended in children and patients under 18 years of age. Clinical evidence of Pulmocoxib in human clinical studies. A clinical study evaluated the safety, tolerability, pharmacokinetic and pharmacodynamic profiles of multiple oral doses of Pulmocoxib in healthy volunteers. 3 sequential doses were studied in this phase 1 clinical trial. Pulmocoxib was well tolerated. There were no clinically significant changes in blood pressure between the treatment groups. Pulmocoxib achieved whole blood concentration of 50 to 70 times higher than in plasma. Pulmocoxib suppressed serum thromboxane B2 and prostaglandin E2 at all 3 doses. Only highest dose of Pulmocoxib suppressed urinary excretion of the urinary prostacyclin metabolite. Pulmocoxib is metabolized through cytochrome CYP3A enzyme. A clinical study evaluated the influence of ketoconazole, a known strong inhibitor of CYP3A, on the pharmacokinetic properties of Pulmocoxib. When given with ketoconazole, the area under the curve increases for Pulmocoxib, but doesn't change the safety profile of Pulmocoxib. In a 6-week study, a randomized, multicentric, phase 3 trial evaluated the efficacy and safety of Pulmocoxib compared with celecoxib and placebo for patients with osteoarthritis, followed by 18-week extension of safety study, totaling 24 weeks. 324 out of 362 patients completed the treatment and 220 completed the safety study. Pulmocoxib showed quicker onset of relief from osteoarthritis as compared to celecoxib. Pulmocoxib showed statistically significant superiority over placebo at week 3, but celecoxib did not show statistically significant difference from placebo at week 3. WOMAC physical function scores at week 3. Pulmocoxib demonstrated better efficacy against celecoxib in all other efficacy endpoints, including WOMAC pain and stiffness subscales at week 3 and week 6. Pulmocoxib showed superior efficacy over celecoxib with statistical significance in physicians' global assessment score. 77.7% of patients taking Pulmocoxib experienced improvement in signs and symptoms of osteoarthritis as compared to 58.9% in celecoxib group. Safety conclusions from 24 weeks Pulmocoxib extension study showed that it was well tolerated and adverse events were generally mild. There were no clinically relevant adverse findings in the analysis of clinical laboratory tests, vital signs, electrocardiogram, or physical examination results. We hope this scientific data and information will help you in confidently prescribing Polvolt 2 mg from Zuventus Healthcare Limited.